And what we showed was during the dates of these major cardiology conferences, like the American Heart Association or American College of Cardiology, patients who have cardiac problems, acute cardiac problems, they actually do better on the dates of those meetings if they by chance are hospitalized when the cardiologists or some cardiologists are out of town.
So they're regular doctors out of town. They're stuck with the kid, the young upstart who couldn't get a paper accepted at the conference, and they have lower mortality rates during the conference. It's shocking, but possibly true.
Yeah, exactly. And it's a type of thing where I actually had the opposite instinct. When I thought about the idea, I thought, okay, staffing is going to be lower. Patients are going to do worse because the staffing is lower, and maybe the staffing of the better cardiologists might be lower. And then we find this finding, which is the opposite of what we thought. And then this goes back to our earlier discussion. Well, what do you do then? Well, first thing you got to do is establish, is this a natural experiment? Show that these characteristics of these patients are identical on cardiology meeting days and non-meeting days. All right, check. We do that. Now we're sort of into what is the mechanism that explains this finding land. And there is an additional data point that we sort of figured out, which I think tells a story, which is that rates of certain procedures fall. They fall by about 30% on the day of these meetings versus the non-meeting days.